Greetings and welcome to another episode of Caring for You with me, Dr. Terence Drew. I've had a number of requests from you, our faithful viewers of our program, about topics to speak about. And one of the topics that surfaced was colon cancer. And so I'll speak about this very common cancer on this show today. What is colon cancer? Colon cancer is cancer that is formed in the large bowel that we call the colon. It is one of the most common cancers there is. But what are the risk factors for developing this type of cancer? We can see it in persons who have certain genetic predisposition. We can see it in persons also who have a family history, strong family history. The older you get, especially above 50 years old, if you have certain colon diseases, such as Crohn's disease, ulcerative colitis, which are inflammatory diseases of the colon, then these persons are very prone to develop colon cancer. So what can you do to help to prevent colon cancer? One, you can have an appropriate diet, a diet rich in fruits and vegetables and soluble fiber. You must also ensure that you drink plenty of water so that you can have good bowel movements. But you can also, what is necessary is to have colon cancer screening. What is colon cancer screening? It is really a test to look to see if you might have colon cancer. And this is done normally in the average risk person from the age of 50 and above. So there are different things you can do. For example, colonoscopy, which you can do, that's passing a camera up the rectum via the anus and all the way up into the colon to look. This is done every 10 years if the colon is found to be totally clean. You can also do fecal occult blood testing. This test has become so advanced that you can do it at home. Just get a small card, you test your stool at home, and you take the results to your doctor if there are any changes. You can also do what we call imaging studies, but some of these studies are not as good as the fecal occult blood test or even the colonoscopy. You can do sigmoidoscopy. That's just passing the camera in one part of the colon up to the sigmoid, and that is coupled with a fecal occult blood test. And so if you do these tests have been shown to help to detect colon cancer very early and give you a better chance of survival. So make sure if you're 50 and above and your average risk, you discuss having one of these tests done for you in order for you to detect it early. But what are the symptoms? The symptoms can be constipation. Sometimes you see elderly patients with constipation. That underlying cause can be colon cancer. You can have stool with blood, abdominal pain, weight loss. And if the cancer becomes advanced, it goes up to the liver, you can develop jaundice and so forth. Some people might even go on to have a big stomach if there is metastasis or movement of the cancer into the lining of the abdomen or the intestines that we call the peritoneum, and that can lead to producing fluid in the abdominal cavity and give you that big belly or that big stomach. Some people can develop DVTs, as we spoke about earlier, as a result of having a cancer like this. So now we know the common people who are at risk, the common signs and symptoms. Once you would have been diagnosed, how are you diagnosed and what is done? You are diagnosed by way mainly of a colonoscopy, that's passing that camera through the anus, the rectum, all the way up in the intestine, where you can pick up either a mass or polyp that is cancerous. That is, and a biopsy is done. That is how it's mainly diagnosed. There are other ways where you can do imaging study like x-rays, and you can also do sigmoidoscopy, which is not passing the camera all the way up the intestine. These can also help. Scans of the abdomen can help to some extent, but the most important one is the colonoscopy. So what is the general treatment? Generally, the treatment is by surgery, cutting out a piece of the colon. Some people might need a bag where you put the colon to the side of the abdomen and give them a bag so that the stool can pass in it. Some people go to that extent. And chemotherapy generally. So those are the foundational treatment of colon cancer. Surgery, chemotherapy. Thank you once again for joining me, Dr. Terence Drew, for an episode of Caring for You with me.